Well, good day. Good to see you all and have you here looking at another one of my PowerPoint videos regarding health conditions. This particular condition is the neck, shoulder, arm, hand syndrome. I am Dr. Ronald Ritchie, and I'm here to try to describe this complex condition to you in as much detail as is reasonable. So let's get right to it. Neck, shoulder, arm, hand syndrome. Well, generally, with the current circumstances and situations, this is a more frequently occurring condition than in previous years. So we're going to discuss what are the symptoms of this constellation of conditions, the reasons for the increasing frequency of the problem, what are some of the conditions which cause this particular pain pattern, and what are the treatment options for each of these various conditions. So let's step right into the first concept, and that is, what are the symptoms? Well, the symptoms typically involve pain, tingling, and numbness in the neck, the shoulder, arm, or hand, or a complex of any of these pains. It can be just pain, just tingling or numbness, but usually it is a group of these. The symptom location does not always indicate the origin of the problem. What I mean by that is that just because a person has pain in their upper arm or their shoulder doesn't mean the problem is actually in the shoulder or the upper arm. Just because they have pain in their fingers and tingling in their fingers doesn't mean that's where the problem is. It can be in different causes with pain in different locations. Well, inflammation complicates the presentation of the condition because inflammation often intensifies pains in multiple areas. Incorrect treatment can mask the real cause. This is a very common thing that I'm seeing these days, is that a healthcare provider will assume that person has a pain in their shoulder, and the shoulder is where the problem lies, and so they'll start treating the shoulder when the pain really isn't in the shoulder. It may be someplace else. And this is especially a problem since so many healthcare visits these days are being done by telemedicine, where the healthcare provider doesn't actually sit down with the person and look at them and put their hands on them. The other thing is that there are complex pain patterns to these health conditions, and they're very common. And what I mean by complex pain patterns is that pain will be in one place and yet tingling may be in another place, or the pain may be up in the shoulder and then down in the elbow, but not in the shoulder. So there are definitely complexities in just the presentation of the symptoms, let alone the origin of the problem. The second point we're going to talk about is why there's increasing frequency of this particular neck, shoulder, arm, hand syndrome. Well, one of the reasons is that we are all very much more sedentary than we have been in the past. The pandemic this year has definitely changed work patterns, it's changed activity patterns, it's changed functions within family, and people are generally just a lot more sedentary. And as a consequence, we are sitting for longer and longer hours. Now, I have patients tell me all the time, I'm working the same number of hours. Well, maybe so. But the thing about it is when you're working from home, you don't have to get up and go very far to go to the bathroom. You don't have coworkers coming over and asking you questions, or you getting up and going seeing other coworkers. You're not leaving your workspace to go get something to eat or go get a snack and then come back. So in all honesty, even if you're working the same number of hours, you're sitting still at your desk or at your table at home for longer periods of time. And then once you finish working, what do you usually do? Go and sit more, watch TV, play games, play cards with family, do other things, and what are you doing? Sitting even more. Well, add to that the aspect of poor diets. Diets that are high in carbohydrates actually are pro-inflammatory. They create more inflammation because high carbohydrate content in a diet, more sugar consumption, creates more inflammation. Well, poor diets come as a consequence of sitting around. honestly, if you think about it, and if you look at yourself very carefully, you'll find that when you're sitting more, you're sitting there snacking on stuff. And what do we usually snack? It certainly isn't going to be carrots and celery or broccoli, and it's certainly not going to be a nice crisp apple. Usually it's some kind of sweet snack. It's chips, it's sweets, it's candy bars, it's cookies, it's things like that that are those really tasty things we all love to snack on. Well, that generates a significantly increased consumption of carbohydrates, producing a much poorer diet. Well, along with this sedation, this sedentary quality of life, is a lack of exercise. Well, that lack of exercise honestly causes muscles and joints to atrophy. Fancy word means to get smaller, to get weaker. The idea of if you don't use it, you lose it is very prevalent. If we don't exercise the magnificent machine of the body that we were given, then that body will become weak. As it becomes weaker, the joints become stiffer. There's less power to hold the body up in a proper posture, and that increases the strain on all the areas of the body, generating more and more health conditions. Well, what are some of the conditions which cause this pain pattern? Well, we're going to go over several of them, and many conditions can cause them, and they are, but not limited to, these are the most common ones, and that's nerve impingement or pinched nerves, rotator cuff problems, bursitis and tendonitis, arthritis, injuries and strains, carpal tunnel syndrome, scalene syndrome, brachial plexus conditions, and shoulder impingements. These are the most common conditions. This is not an exhaustive list. There are more things that can cause pain in the neck, shoulder, arm, and hand than just these, but these are the main ones. These are the ones that you're going to find the most commonly. Well, let's jump right into the very first one, and this is one I'm sure most all of you have heard. Rotator cuff. Rotator cuff syndrome and shoulder impingement syndromes. I'm putting both of these together, although they are two different conditions. They are very similar to one another and can be caused by many of the same kinds of circumstances. Rotator cuff is a very common problem. The rotator cuff is actually a group of 4 muscles. These 4 muscles attach in and around the shoulder blade or the scapula, and they're called the rotator cuff because they rotate the arm inwards and outwards, or internal and external rotation, and the 4 tendons of these muscles attach around the upper a portion of the humerus, the humeral head, as you can see in this picture on the left, and so they wrap around the top of that humerus like a cuff on a sleeve of a shirt. So that's why they are called the rotator cuff muscles. As I said, there are 4 muscles, and it's got an acronym called SITS, S-I-T-S, supraspinatus, infraspinatus, teres major, and subscapularis. That's the 4 muscles. Well, pain is usually in the shoulder and in the shoulder joint proper. And what I mean, it's right up there by the top of the clavicle where the shoulder blade and the collarbone meet, and that's the roof of the shoulder, and the pain is usually right there in the top of the shoulder, sometimes towards the front, sometimes towards the back, but it's usually right there in the shoulder. The rotator cuff is almost always caused from strain and improper wear. But shoulder impingement syndromes, that picture you just saw pop up there, can be caused from strains and improper wear and tear on the shoulder. The difference is that rotator cuff problems or rotator cuff syndrome usually is a result of some kind of strain to the shoulder, whereas impingement syndromes are more from wear and tear. And that is, you can see as the upper arm bone, the humerus moves outwards, it pushes up into the roof of the shoulder and impinges and grinds on the rotator cuff tendons, most commonly the supraspinatus muscle, producing an impingement syndrome. Both of these cause the pain in the top of the shoulder and are usually worsened with any kind of raising the arm up, raising the elbow up to shoulder level or above, turning the arm out to reach up, like to put your hand on the top of your head or reach up in a cabinet, and even also trying to reach behind you like you're trying to tuck in your shirt. Those will produce some pretty significant pains in those areas from rotator cuff syndrome and impingement syndromes. But they aren't the only ones that can cause that kind of pain. Is tendinitis and bursitis. Well, tendinitis and bursitis are inflammatory conditions in the shoulder, usually producing pain in the front of the shoulder. As you can see this picture here, biceps tendinitis. The biceps muscle is that big muscle in the front. It's called biceps because it's two parts. Bi meaning two, septus meaning parts, two parts. And it has two tendons. And very commonly, either one of the tendons, either the long head or the short head of the biceps, can become inflamed. And this picture here shows the long head of the biceps being inflamed, and that will cause tendinitis. But then there's also bursitis. Tendinitis and bursitis usually come from some kind of strain, most of the times an unaware type of strain. I'll give you an example. I had a patient here recently came in and she was having tremendous pain in the front of her shoulder, and come to find out after examining it, she has biceps bursitis, tendinitis. And what happened was she said, well, I haven't lifted anything or pulled on anything. And as we talked and as we were talking about things and how long it's been and talking about events, all of a sudden she goes, you know what? I know what happened. I was walking my dog. She had a big dog, and the dog bolted and jerked her arm when she was holding the leash, and she jerked back against it. And that traumatic event, she said, it hurt my shoulder, but then I didn't think anything of it because it stopped. Well, that traumatic event, that strain, generated the biceps tendinitis because the tendinitis was not resolved shortly thereafter. It became chronic. Pain is usually in the front or top of the shoulder. It is usually a dull pain, but an intentional pain. And that is when you go to reach out in front of you, such as reach for your steering wheel, or reach into your refrigerator to pick up something, or reach out to a drawer to pull the drawer open. The pain occurs with that intentional movement, with that movement. But at the same time, there's also limited movement, usually trying to reach the top of your head, like comb your hair, reach up to brush your teeth. You can barely raise your arm up that far, sometimes having to lift your arm with the opposite hand. That's pretty classic presentation of bursitis and tendinitis in the shoulder. The problem is that if this is not resolved fairly quickly, it can turn into a frozen shoulder. The lady I just spoke of a moment ago, she came in because she couldn't move her arm at all. She couldn't move her shoulder at all because in the intervening months, scar tissue had developed and froze the shoulder up, so she could not move it at all. And at that point in time, she not only had pain in her shoulder, she had pain radiating down to her elbow and radiating up onto the top of and back of the shoulder blade. So again, a complex pain pattern can generate from what's often thought of as a single site condition. Well, let's move on to the next one. Arthritis and injuries. Injuries often produce very clear symptoms. Here we go. What do you think the problem is with that shoulder? Well, that's an X-ray of a dislocated shoulder. That joint has been pulled apart. You can see how the upper arm bone, the humerus, has been pulled out of the socket. That's an inferior subluxation, dislocation of the glenohumeral joint. Well, it's pretty obvious to see that because if you looked at that person, you could tell that shoulder looks awfully different from the opposite shoulder. So injuries typically produce very clear symptoms. Now, chronic problems usually lead to arthritis. And here's a nice little graphic image to show you where arthritis typically occurs in a shoulder. It can occur in 3 places, and usually it's a complex of these 3 places. In the top up there, that's called the roof of the shoulder at the AC joint, around the head of the humerus, and in the shoulder blade at what's called the glenoid fossa. All those areas can develop arthritis. The classic presentation of arthritic changes in the shoulder joint is grinding and cracking and popping and noise every time you move your shoulder. It's not always arthritis because there are some conditions which can produce that same kind of crepitus that is not arthritic, but it most of the time is. So again, complex pain patterns are a common problem with neck, shoulder, arm, hand syndrome. Next one, I'm going to put these two together, called brachial plexus and scalene syndromes. You probably haven't heard of these because they don't exactly roll off your tongue, but they are common problems. Brachial plexus problems usually start from a seatbelt injury. How many times has somebody been in a car accident and a seatbelt, and that seatbelt traumatizes the collarbone? Well, right underneath that collarbone, as you can see from this picture, is what's called the brachial plexus. That's a bundle of nerves and blood vessels that run under the collarbone. And it doesn't matter whether you're in the passenger side or the driver's side, the front seat or the back seat. Shoulder belts can traumatize that brachial plexus and create symptoms that radiate all the way down to the fingers. But the traumatic origin from the seatbelt is right up there in the shoulder. Sometimes it can be caused by infection in the area, or inflammation from other causes besides trauma that affects that brachial plexus, causing pain everywhere from the shoulder all the way down to the fingers, or any mixture of regions in between. The scalene syndrome usually includes pain on the front and lateral side of the neck that radiates down into the shoulder. Sometimes it doesn't stop at the shoulder. It goes into the upper arm to the elbow. And it's usually caused by muscle spasm in a group of muscles called the scalene muscles. And here's a nice little illustration. If you'll look right in the upper part, it says scalene muscles, and there's a thing that says brachial plexus. Well, those muscles attach from the neck to the first and second ribs on that side. They're commonly injured in auto accidents, but they can be injured in any type of fall or strain to the shoulder, head, or neck. And although somebody falls and they say, oh, it's no big deal, and they don't feel like their neck's got a problem, they start developing pain in their shoulder and the collarbone and then the shoulder joint and then down in the upper arm, and it's injury to these scalene muscles. The thing about it is that all of these produce the same kind of pain in the arm, tingling, and numbness down into the shoulder, arm, hand, or fingers. So you have to differentiate which of these is the problem because each requires slightly different treatment. Again, complex pain patterns can result. Well, let's move to the next one, and I'm sure everybody's heard of this one. Carpal tunnel syndrome. Well, everybody thinks they know what carpal tunnel syndrome is. Well, what's the carpal tunnel? I'll give you a little quiz. What's the carpal tunnel? Well, there you go. There's a picture right here at the bottom. Beautiful illustration. The carpa means hand, and in the hand there are actually 3 tunnels. The carpal tunnel, which is on the palm side of the hand, and you can see there that little red area right there. Right above that, if you look on the right picture, you see this transverse carpal ligament and the flexor retinaculum, the retinaculum, which is connective tissue that wraps around the wrist. Those hold the wrist together and are tunnels through which nerves, blood vessels, and tendons pass to get to the fingers of the fingers and the hand. Well, that little opening on the palm side of the hand there, that is called the carpal tunnel. On the back of the thumb, there's another one called the thenar tunnel. On the back of the hand, there's another one called the dorsal tunnel. So there's different tunnels in the hand. The carpal tunnel is the most commonly injured, and it's usually a result of repetitive strain or injury to the carpal tunnel. Much of the time, it's a consequence of holding something tightly with the hand, closed kinetic chain stuff, like holding onto a mouse, gripping a hammer, gripping a wrench, or auto mechanics and people who use air tools and air hammers and air nailers get that because they're gripping it hard and squeezing, and there's a tremendous amount of vibration. Well, it's called a repetitive use or a repetitive strain syndrome. And what will happen is it will cause pain and tingling and numbness in the fingers of the hand, and you can see the blue picture here where it involves the thumb, index, and middle finger. That's usually where the problem lies. That's usually where the symptoms lie, the thumb, index, and middle fingers. But if left untreated or improperly treated, or self-care that works inappropriately, the pain can actually radiate back up the arm. The pain in the tingling in the fingers can diminish, and then the pain in the forearm, elbow, and lower upper arm can become more severe than the pain in the hand, and people have the condition misdiagnosed. So pain and numbness and tingling are mainly at night. That's one of the differentiating aspects of carpal tunnel syndrome, is that the pain, tingling, and numbness in the fingers and the hand are usually worse at night, to the extent that it wakes you out of a sound sleep because of the intensity of the symptoms. So that's one of the unique features about carpal tunnel. But it doesn't always present that way. Sometimes it will be quiescent or quiet at night and not be too much pain. But anytime you grip a steering wheel, grip your hairbrush, hold on to a bag, hold on to a handle, pull on a rope, grip a doorknob, grip your mouse, the pain and problem comes right back, and then weakness starts to develop in the hand. It can be a very complex situation to deal with. So let's move on to one more aspect, the final aspect, impingement or pinched nerves in the neck. The problem originates in the neck, although neck pain may not be the primary pain, the primary symptom. It can be sudden or a gradual onset. The pain can be constant or intermittent. So it can be a broad mixture of a great number of symptoms. Symptoms can be produced anywhere from the neck all the way down to the fingertips, and even skip in between, like it'll be a pain in the neck, a pain in the elbow, and a pain in the hand, but the shoulder and forearm and upper arm don't have any pain at all. So the symptoms can present in many different places. It may occur with or without disc problems. Cervical nerve impingement do not necessarily have to have disc problems, and very commonly they don't. So it's a little bit of a tricky issue to diagnose properly, and it may or may not have a headache. Just because a person has pinched nerves doesn't mean they only have pain in their arm. Sometimes it can have unilateral or single-sided headaches. They're usually in the back of the head and radiate around to the top of the head or the side of the head. They're usually not migraine-type headaches, but they can have a headache, or maybe not. So it can be quite complex. So these are conditions that need professional eyes and professional examination. So let's go back to conditions which cause this particular syndrome. Nerve impingements, rotator cuff, bursitis, tendonitis, arthritis, injuries, carpal tunnel, scalene and brachial conditions, and shoulder impingements. These are all the most common problems that cause this particular complex of symptoms. Well, the treatment options. Well, honestly, the treatment depends upon the primary cause. And as I said early on in this presentation, improper diagnosis or misdiagnosis, because of our current conditions of being a lot of telemedicine, phone visits, and video visits, and not actually getting your hands on somebody to actually physically examine that person and question them more thoroughly based upon physical findings, the primary cause is often missed. But the treatment is going to depend upon the primary cause. Now, having said that, no matter what the cause of these conditions, most all treatment for all of these conditions centers around three primary things. Number one, inflammation reduction and the stimulation of the healing process. All of these conditions that we just talked about involve some kind of inflammation. So getting the inflammation reduced is extremely important, because inflammation and the healing are opposite sides of the same teeter-totter. When inflammation is up, healing is down. When inflammation is hot, healing processes are suppressed. So you got to get the teeter-totter going the opposite direction to reduce inflammation so healing may occur. The second thing is The second aspect is restoration of movement. All of these conditions will end up with some type of restriction of motion and loss of function. So restoring movement back to the neck, back to the shoulder, back to the elbow, to the wrist and hand. Restoring movement is of great importance because, third point, is you can't return function and regain strength until movement is restored. So you have to reduce inflammation to help stimulate the healing process, restore movement, and then return function and regain strength. All of these conditions we talked about have those three elements in common. Now, there are specific treatments unique to each particular cause. You certainly wouldn't treat a frozen shoulder like you would a carpal tunnel. And you certainly wouldn't treat an impingement syndrome like you would a cervical nerve root impingement, because there's unique things about each of the origins that require specific diagnosis to determine its cause so that you will know which kind of specific care, in addition to these general aspects, that must be performed. That is a short description of the major causes of neck, shoulder, arm, and hand syndrome. I'm Dr. Ronald Ritchie. My office is in Garland, Texas. I have an email, and if you want to ask me some questions, feel free to contact me via email, or you can call me at my office. If you live in the area and you want more information, please come by. Call me up and come by. We can sit down and talk about what conditions are problematic and how we go about diagnosing that to determine what kind of treatment is appropriate for your particular condition of the neck, arm, and hand syndrome. So if I can help you one day, please let me know. Until then, good health, and we'll see you later.